This is Teresa Pablos, editor-in-chief of Dr. Bicuspid, and welcome to another episode of Dental Dose. I am with Tom Viola, pharmacologist extraordinaire, and today we are breaking down some more local anesthetic myths. And today is, please tell me if I'm going to say this right, Tom, Bupivacaine.
Look, that's really good. That's really good. I always say it this way. I always say Bupivacaine. And people look at me like, do you have to use the U so much? And I'm thinking, well, it's so hard to say Bupivacaine. And I just like to lengthen it a little bit. Bupivacaine. So
I'm curious if dental professionals also struggle with Bupivacaine.
it's not an easy one to say.
And
a lot of people just know it by its brand name, which actually isn't really in existence, I don't believe anymore, Marcaine, which is a lot easier to say.
Yeah, Marcaine is much easier to say. Lidocaine is easier to say. Articaine, Carbocaine, just Bupivacaine, it got a lot of L's. Anyway, that is not one of the myths we're breaking down though today. We're not talking about the name, but we are going to be talking about some myths. So start us off, Tom. What is myth number one for what you might not know about Bupivacaine?
So Bupivacaine's claim to fame in dentistry has always been one thing. It is the longest acting amide anesthetic agent we have in practice. So if you were going to do a rather long procedure, let's say full mouth extraction, long oral surgeries, sinus lift, where the patient's going to be in the chair for literally hours, okay? You want an anesthetic agent that's going to last a long time. Why? Because the central problem with anesthesia is, and we'll talk about this when we get to the myth busting for Carbocaine, okay, Bupivacaine. The central concept is, well, I don't want to, I don't want to use too much epinephrine, or I'll use a rather shorter acting anesthetic and I'll inject more as I go along. But the problem with that is every time you inject the patient, when they see that needle coming, they're getting epinephrine. Okay, they're getting it from their adrenal glands because it's just this fight or fight response to being, injected, to having this sharp instrument used on you. Okay, so Bupivacaine fills the need for this rather super long-acting anesthetic agent that will keep the patient profoundly anesthetized for hopefully the entire length of the procedure. Now, do you sometimes need to add more Bupivacaine? Yeah, if it's oral surgery, is the patient, sedated to the point where they don't even know what you're doing? Perhaps, but the point is, you want something that's long acting. Okay, so that is the claim to fame, and that's wonderful. That's what everybody knows about Marcaine and Bupivacaine. But there's so much more to Bupivacaine beyond that. The next biggest point is that Bupivacaine, because it's so long acting, is often used not just as an anesthetic agent, but also as an analgesic. So if so let's say you've got a patient and is going to be in pain after the procedure. You know it, they know it, the whole world knows they're going to be in pain. Okay, so do you just send them on their way and say, yeah, go ahead and go home and take an anti-inflammatory and analgesic combination like ibuprofen and acetaminophen, and good luck, buckaroo, that kind of, or instead, since Bupivacaine is so long acting, would you might be better served, and would the patient be better served if you just injected them with Bupivacaine right before they left the office? That would keep them numb for hours afterwards. And if you didn't want, let's say, to write a script for an analgesic, especially opioids, that might be a good alternative.
So it sounds like, the benefits are obvious as a patient, but I'm wondering, what are the downsides as a patient of having my mouth with a long-acting local anesthetic for potentially hours after a surgery?
Well, that's the thing. People go home and they get their strength back up, and after a while they get hungry and they want to eat, right? So let's say they eat something that's got some consistency to it and they start chomping down. It's not unusual for some people to eat more than the food they're eating, like literally eat the inside of their chin, the side of their tongue, inside of their cheek, side of their tongue, and so because they're just chomping down without really knowing what they're chewing on. So that's certainly an issue, right? Self-inflicted soft tissue injury, right? The other reason that it's concerning is Bupivacaine is rather long acting, but also lasts in the body a long time. So often ask my students this, I'm like, so when the anesthetic wears off, where does it go? And usually,
No idea.
and that's what they like, they kind of scratch their head and say, I don't know, I never thought about that.
I've never thought about that.
So it goes in the patient's bloodstream, right? Like everything else that we do,
That makes sense.
right? Okay, so it goes in the patient's bloodstream. All right, but that, where does it go then? It goes anywhere it wants to go, right? And the two places that it normally ends up are heart and the brain.
Hmm.
And that's where you can see side effects, because local anesthetics are not just used for anesthesia, because they're technically nerve blockers. They're sodium ion channel blockers. They can slow down conduction in the heart, and they can slow cognition in the brain. So you're likely to see side effects. And a lot of people report that after getting the Bupivacaine, they're awfully tired. They're kind of like, oh, I really can't keep my eyes open. And that could be one of the side effects of Bupivacaine.
So how should dentists balance the benefits of bupivacaine and the side effects of making sure, trying to maximize the benefits and reduce the side effects?
So if all things were equal right now, Teresa, we could just say, flip a coin, right? We'll try to balance it. But now I'm going to stack the deck, okay? And pile on the advantages so that the dentists and hygienists out there who administer anesthesia could see this part or this side of bupivacaine that they may haven't seen before. And that is that bupivacaine is long acting, not so much because of its pKa and the biochemical factors, but also because bupivacaine just has a greater affinity for the neuronal or axonal membrane. So it really does latch on to membranes and sticks around for a long time. Well, that's one of the reasons why it lasts so long. It's one of the reasons why it causes side effects for long after. But it also means that bupivacaine can be used sometimes as an anesthetic of last resort. So, right, you've got a patient that's just difficult to anesthetize. What do you do in that situation? So where other anesthetics may fail, bupivacaine may be your drug of choice. Okay, so who's so difficult to anesthetize? Redheads, first of all.
Interesting.
Don't pick on redheads, Viola. No, I like people with red hair. I like red hair, but they have difficulty becoming, profoundly numb. So what do you do?
I've heard one of my good friends has red hair, and she's always like, it doesn't work for me like it works for everyone else.
Right. So what do you do in this situation? Miss Claro? I mean, that's not going to work, right? You can't dye it away, right? So even if you dye their head black, it's still red underneath. Okay. So that's not going to work. All right. So you've got those folks. How about the folks who had a previous history of substance abuse, specifically stimulants like methamphetamine, cocaine? They're awful difficult to anesthetize as well because they're resistant to the effects of anesthetic agents. And how about heavy cannabis users? So cannabis users, if they're heavy users, are also resistant to the effects of anesthetics. So all of a sudden, bupivacaine seems to become like, hey, wait a minute. Well, when in doubt, use bupivacaine. Of course, the hygienist listening to this right now saying, are you stupid, Viola? And I would say, ask my ex-wife, she'll tell you. No, I would say, well, yes, I know what you're about to say. You're saying that, why would I want my hygiene patient to be numb for 10 hours? Understandable. But it can be used, in combination with other anesthetic agents to get that nice mix you're looking for. Like maybe start off with an immediate acting agent like articaine, and then follow up with let's say a half a carful of bupivacaine on the back end.
So it seems like probably like it's going to be for most, if not all, medications. It's all a case by case basis. The patient in your chair, when their unique factors are, whether they have red hair or whether they may have used stimulants. And it's going to be, is it going to be the best choice for that patient?
Agree, as always, case by case basis. Drives me crazy. And that's why when I first started out, I used to have hair. Now, as you can tell, use a
all the stress, just you pull it out.
See, pull it right out. Yeah.
Well, thank you so much for talking about bupivacaine. I will never be able to say that word, but that's okay. At least all of you in the video know what we're talking about because Tom can say it so well. Once again, I am Teresa Pablos. Be sure to watch Dental Dose on Dr. Bicuspid every other Friday.
Thanks, everybody.
Thank you.